If you take vitamin D and calcium, but skip vitamin K2 MK7, you might be missing the traffic cop that helps point calcium to your bones and keep it away from places it doesn't belong. In the next few minutes, you'll learn what K2 MK7 does, who may benefit, who should avoid it, and how to use it safely with food first and supplements second. Quick reminder before we dive in. Always talk with a qualified clinician before starting or changing any supplements or medications. Here's the 1-minute snapshot. Vitamin K2 MK7 may help people who want everyday support for bone strength and healthy calcium handling, especially adults who rarely eat fermented foods like natto or certain cheeses. It may also interest postmenopausal women and older adults who are focused on maintaining bone density over time. You should avoid K2 supplements if you take warfarin or another vitamin K-dependent blood thinner unless your prescriber specifically guides you, because it can change your clotting test results. One important safety note: fat-soluble vitamins absorb best with a meal that includes some fat, so take K2 with food to reduce stomach upset and improve uptake. One simple action step you can take today is this. Look at your weekly menu and add one reliable K2 food source, like a small serving of natto or a slice or two of aged cheese. And if you still want a supplement, consider a modest daily dose and share it with your clinician so it's on record. So what is vitamin K2 MK7? Vitamin K is a family of nutrients. K1 mostly comes from leafy greens, K2 is a group called menachinones, and MK7 is one specific member you often see in supplements. Think of K1 as the everyday worker for blood clotting, and MK7 as the longer-lasting specialist that helps activate proteins that guide calcium to the right places.
Here's an easy analogy. Imagine calcium is concrete. You don't want concrete dumped in your pipes, you want it poured into your house frame. MK7 helps switch on the workers, the proteins that tell concrete where to go. In biology, those workers include osteocalcin in bone and a protein called MGP in blood vessels. When they're switched on, they can bind calcium appropriately. How does MK7 work in the body? First, activation. Your body uses vitamin K as a helper for an enzyme that carboxylates certain proteins. That's a fancy word for flipping them into their active form so they can grab calcium. Second, distribution. Activated osteocalcin helps move calcium into the bone matrix where it belongs, while activated MGP helps keep calcium from depositing in soft tissues. Third, staying power. MK7 has a longer half-life in the body compared to some other K forms, which means a small daily dose can keep those proteins activated more consistently over time. Your gut bacteria can produce some K2, and the body may convert small amounts of K1 from greens into certain K2 forms. But how much you actually absorb from gut production is uncertain and probably limited. Basic lifestyle factors matter a lot. Diets that include fermented foods provide more K2. If you have fat malabsorption, such as after certain gut surgeries, with untreated celiac disease, pancreatic problems, or when using fat-blocking drugs, your vitamin K absorption can drop. Very low-fat diets can also reduce absorption because K vitamins need fat to get in. Where do you find MK7 from food and daily habits? First, the richest common food is natto, a fermented soybean dish popular in Japan, which is naturally high in MK7. Some aged cheeses like Gouda and Brie provide smaller amounts. Fermented foods vary widely, so amounts aren't consistent. Animal foods like egg yolks and certain meats contain mostly another K2 form, MK4, which still contributes to the family but isn't MK7. For most people who don't eat natto, total K2 intake from food may be modest. That's where supplements show up. MK7 supplements are usually derived from fermentation and come in microgram doses.
What about deficiency or context? True severe vitamin K deficiency is uncommon in healthy adults. When it happens, it can look like easy bruising or bleeding and needs medical attention. More often, the issue is low intake over time, which can leave many of the K-dependent proteins only partly activated. Higher risk groups include people who rarely eat fermented foods, those on long-term broad-spectrum antibiotics, people with fat malabsorption, those after bariatric surgery. older adults with limited diets, and some vegans who don't include natto or fortified foods. If you're wondering about labs, there isn't a standard clinical blood test for K2 status. In research, scientists look at undercarboxylated osteocalcin, or MGP, but those aren't routine in clinics. Practical labs to discuss with your clinician include vitamin D, calcium, and parathyroid hormone when you're thinking about bone metabolism, and INR if you're on warfarin. What does the evidence say? For bone health, research is mixed to promising. Several randomized trials, usually in the dozens to a few hundred people, often postmenopausal women, show that daily MK-7 can improve activation of bone proteins and may modestly slow age-related bone loss over 1 to 3 years. Not all trials agree, and effects on fracture risk have not been clearly proven. For heart and vessels, findings are early to mixed. Some small trials report improvements in measures of arterial stiffness and in the activation of vascular proteins. Larger, longer studies looking at heart outcomes like heart events are still needed. For general health, evidence is early. So think of MK-7 as a support nutrient with biological plausibility and encouraging markers, but not a magic bullet. Let's talk supplement buyer guidance. Common forms on labels include menaquinone 7, written as MK-7. Many quality products provide the all-trans form, which is the natural active shape. Typical effective dose ranges used in research and in products are about 90 to 180 micrograms per day. Some use as low as 45 micrograms, others as high as 200 micrograms. There is no separate official RDA for K2. The general adequate intake for total vitamin K is about 90 micrograms per day for most adult women and about 120 micrograms per day for most adult men, mainly based on K1 and normal clotting. There's no established upper limit for vitamin K in healthy adults. Timing is simple. Take MK-7 once daily with a meal that contains fat. Morning or evening is fine. Consistency is what matters. For quality, look for third-party testing seals like USP Verified or NSF, or a brand that shares test results and follows good manufacturing practices. For simple cost math, if a bottle costs $20 and contains 120 capsules of 100 micrograms, that's roughly 17 cents per 100 microgram daily dose. Prices vary, but doing this math helps you compare.
Safety and interactions are important. Most people tolerate MK-7 well. Occasional side effects include mild stomach upset or nausea if taken on an empty stomach. The big red flag is interaction with warfarin and similar vitamin K-dependent anticoagulants. Adding K2 can change your clotting level and make your medication dose wrong, which can be dangerous. If you're on warfarin, only adjust vitamin K intake, including supplements and diet, with your prescriber and with follow-up blood tests. Other medications can reduce absorption of fat-soluble vitamins, including K. Examples include orlistat and bile acid sequestrants, and long courses of some antibiotics can reduce K made by gut bacteria. If you have a bleeding disorder, liver disease affecting clotting, or you're scheduled for surgery, talk with your clinician first. In pregnancy and breastfeeding, food sources of vitamin K are generally considered safe as part of a normal diet, but data on MK-7 supplements specifically are limited, so use only if your prenatal care team recommends it. Who likely benefits versus who likely will not? If you rarely eat fermented foods, want simple support for bone protein activation, and aren't on warfarin, then yes, a modest daily MK-7 dose with meals could make sense. If you already eat natto or fermented cheeses often, have no bone concerns, and prefer food-only approaches, then no, a supplement may add little. If you're on a vitamin K-dependent blood thinner, then no, do not start MK-7 unless your prescriber actively manages your dose in testing. If you're hoping MK-7 alone will fix osteoporosis or reverse artery plaque, then no, the evidence is not that strong. Use it as part of a broader plan. A few recent takeaways in plain language. First, more recent small clinical trials and pooled analyses continue to show that MK-7 reliably improves the activation status of vitamin K-dependent proteins in bone and blood vessels. That's a mechanistic win, but it's a marker, not an outcome. Second,
Several studies running 1 to 3 years suggest a modest slowing of bone loss in some groups, especially postmenopausal women, but fracture data remain limited. Third, early work on artery stiffness looks encouraging but is still small and mixed. Bottom line, the biology makes sense, short-term safety is good for most, and the outcomes we care about most need bigger and longer trials. Stacking and timing with lifestyle can help. MK-7 pairs well with vitamin D3 because D helps you absorb calcium and make bone proteins, and K helps activate those proteins. Magnesium is another quiet helper for bone metabolism. Adequate protein and regular strength or impact exercise give your bones the signal to stay strong. Take MK-7 with a meal that includes fat, olive oil, eggs, yogurt, avocado, nuts, or a main dish cooked with oil. What competes for absorption? Fat-blocking drugs and some gut conditions, as mentioned, and taking it on an empty stomach can reduce uptake. Calcium doesn't block K2, but try not to swallow a handful of different fat-soluble vitamins all at once if you tend to get queasy. Split them with meals. Let's build a quick 30-second plan for a few common situations. If you're a budget-focused eater, start with food. Add a weekly portion of natto if you enjoy it, or work in small amounts of aged cheese. If you choose a supplement, look for a simple MK-7 at around 90 to 120 micrograms, take it with your largest meal, and track how you feel for 3 months. If you're vegan and don't eat fermented soy now, consider trying natto or a vegan MK-7 supplement from fermentation. Same dose range and with food. Keep your vitamin D and protein on point. Myth versus fact lightning round. MK-7 is not the same as K1, both are vitamin K, but they act a bit differently and circulate for different lengths of time. K2 is not a blood thinner. In fact, it supports normal clotting protein activation, which is why it conflicts with warfarin. More is not always better. Typical MK-7 amounts are in micrograms, not milligrams, and going far above label ranges hasn't been shown to work better. Here's a clear way to move forward. Start with food and movement. If you decide to add MK-7, choose a modest daily dose, take it with a meal that includes fat, and pair it with vitamin D, magnesium, protein, and strength training. Avoid it if you're on warfarin unless your prescriber directs otherwise. The evidence for bone markers is encouraging, early to mixed for long-term outcomes, and the safety profile is generally good for most healthy adults. Have you ever tried K2 MK-7? Share your experience in the comments and let us know what supplement you would like to learn about next.